Namibia is among the top 10 countries most affected by tuberculosis in the world. There are more than 9,000 people diagnosed with TB, of which 46 are drug-resistant patients. TB is also one of the leading causes of death in Namibia and has resulted in Xau and her younger brother Xau being orphans. Their parents died in 2011 and 2012 from extreme drug-resistant TB XDR, while their siblings were 12 and 6 years old. They too were eventually diagnosed with XDR-TB in 2011.
We had to wait for a year for the XDR treatment to be available.
Later, a life-saving treatment which gave them new hope was introduced. The two were put on a cocktail drug of 14 tablets per day each. This resulted in them missing out on school for 6 years.
We were no longer coughing like we used to, and our sputum changed from positive to negative. The doctors and the nurses become our new family. We are very happy for the interventions and medicine that made it possible for us to get better. We are here today and we are cured. We are looking good, you see?
This was made possible by the U.S. government, which provided technical support, guidelines, diagnostic and surveillance system, plus a life-saving bedaquiline drug. The costlier bedaquiline comes at a price tag of $1,000 per patient per day.
But it remains critical to ensure that people living with HIV minimize their risks of contracting TB. This is best done through preventive therapies, such as IPT, and prompt diagnosis and treatment of active TB cases.
XDR-TB spreads through tiny droplets via coughs and sneezes. When an infected person shouts or sings, the bacteria can float in the air for several hours, putting those who administer TB patients at high risk.
You are dealing with one of the most difficult conditions to treat, MDR and XDR-TB. Yet, despite the difficulties, despite the complications, despite the risks that you as health workers also are facing for getting infected yourself, you remain dedicated and you remain focused. And for that, I want to say thank you.
TB isn't just a physical battle, but a mental and emotional struggle too, where patients need to find the courage to fight on and live the life they always wanted, and it is possible. I'm Lami Hong reporting for NBC News.